Hello, this is Dr. Adam Kopsky from Advanced Rehab and Medical, and one of the common questions that I get a lot is, should I do ice or should I do heat? And so I wanted to briefly go over when you should apply one or the other. And so a lot of times new patients will come in and I'll be like, with new injuries, and I'll be like, so what have you been doing to help? And besides medications, they'll more likely than not, instead of saying ice, they'll say heat. And so one thing is, when you have an acute injury, meaning between it just happened within the last 48 to 72 hours, you want to apply ice. And the best thing I always remember is in playing sports, is anytime you sprain an ankle in basketball, no one's rushing to grab heat to throw on that sprained ankle, because that's just going to add fuel to the fire. So always think of the word inflammation. It's got the word flames right in the middle of the word. And so if you go and throw heat on something that's already inflamed, it's just going to make it worse. So even though it loosens everything up, then you go and sit down, then it just makes it even worse. So always remember, in doubt, to always use ice. So one thing too, on your back or neck or wherever your complaint is, to get a good sturdy one like the one we have here in our office. So the one tip you want to do though is never put this directly on the skin. You want to make sure you have a barrier or towel and then place it there, because it could irritate the skin. And also make sure that you don't leave it on there for more than about 30 minutes, because you could cut the circulation off for too long, and that's not good. On the contrary to that, when is the safe to use heat would be after the acute phase is over, within about after the 72 hours phase or the 3 days. Then everything's calmed down. Then we want to come in and enhance the healing, and that is shown here that we got is the heating pads. Now the one thing with the heat is, I hear all the time is, oh, I put the heating pad on there. Now one thing we do in the office here is use moist heat. So if you're using dry heat, that is actually harmful, because we're made mostly of water. So the soft tissues and muscles have water, about 80%. So if you put the dry heat on there, it's actually bringing the hydration out of the tissue, which is not good. So make sure at home, if you have a heating pad, to apply I like to damp a washcloth and put that on the skin. It can be lukewarm, then put your heating pad on top, and that'll allow hydration to sink into the tissue and enhance the healing. So I hope you found this helpful. If you have any questions, be sure to comment below or come ask us at the office. Thank you.